a case of one 12-year-old small girl who was having high blood sugar, and when HbA1c was ordered, so this came out to be as a value, and 9.4 means pretty high. 9.4 means at any point of time she is maintaining a sugar of more than 200 milligram per dl. That's pretty much for a small girl. So different investigations were carried, and blood sugar level, blood sugar fasting, if I remember correctly, was 234 something milligram per dl. So what were the symptoms? Symptoms were excessive, excessive hunger, thirst, and urination. So she was asking for food continuously. She was always hungry, and she was asking for water, cold drink, and anything which can, quench her thirst. And she was bedwetting also. So, like the night visits to the toilet, they increased, and urination was there. So, bedwetting was also there. Also, before these investigations could take place, she was having one spell of flu or fever, which was unusual, and she recovered in longer time than it is expected. Then, and also cuts, like while playing, if she had a cut, she could not heal it properly. The healing time was delayed. So they went to the pediatrician for the reference as like a lower immunity or excessive hunger, thirst, urination, like maybe there are worms in the stomach or worms in the intestine. But turned out that she had diabetes type 1, DM1. So DM1 is where there is no insulin at all. No insulin at all. Not less insulin. No insulin at all. Once diagnosed, it is permanent, and now the patient will be, that kid will be on insulin for lifelong. So it is very important to diagnose it properly, cross check if one lab has given a report which suggests DM1, diabetes mellitus 1. Please cross check with other labs also before you start your insulin. So because once insulin is started, then the person, the kid, the parents, they all have to be in that 100% invested. Every meal should be every meal will be planned according to the insulin doses and all that. So DM1 means complete lack of insulin. It has genetic predisposition. There are HLA loci which are associated. But how does it differ from DM2? DM2, most common type of diabetes we find in adults. What is the difference? Symptoms are pretty much the same, but the difference is that there is some insulin that we can work on. It's not about the insulin level in DM2, it's about the insulin resistance in DM2. But in this kid there is no insulin. So if you go for insulin levels, serum insulin level, reference range, which is normal range is 3 to 30, and in this kid it will be maybe 0.1, 0.1, 0.3, 0.5, anything which is really less, almost negligible. But if you go for insulin levels in DM2, it will be around maybe 10, 12. So what is happening? Why is diabetes mellitus 2 is happening? Because your organs, the organs are showing resistance to the usage of insulin. So it is not about the insulin levels per se, it's about how much insulin is being used by the organs when there is a glucose spike. Okay, so this is the difference between DM1 and DM2. And also in children, DM2 is not happening, DM1 is happening. So it is mostly because of the lack of insulin, and it takes some time to clinically manifest itself. So if this kid was diagnosed maybe in when she was 12 years old, maybe it was happening like 6 or 7 years ago, and it was happening subclinically. Clinically, it manifested as excessive hunger, thirst, urination, nausea, vomiting, and delayed wound healing, lack of immunity, low immunity. So HbA1c is a very like a screening test whether your kid is okay or not. And also if patient has gained weight, like small kid but patient is gaining weight rapidly, please go for sugar fasting levels and HbA1c, because you never know that if your kid is suffering from HDM1 or not. Do not think that no, it cannot happen to our kid. Yes, God forbid it happens. But if it happens, then definitely you should know that it is there, because there is this condition which is called as DKA. What is it? It is diabetic ketoacidosis, and it's fatal. Diabetic ketoacidosis, where ketone bodies start forming in our body or in that patient's body to be utilized as the energy form instead of glucose, and these ketones can cause coma in the patient and death as well. So please take care. If you are going for the routine packages for yourself, just include one very simple basic package for your kid as well, especially if the kid is gaining weight. Gaining weight should not be treated nicely in a kid. Oh, my baby, my chubby baby. No, it should be taken seriously because it can lead to complications in anybody. So kids are also to be included, especially in this era where obesity is very common among kids.